Hello, my name is Christiana Scott. I am a student at DNE working towards my bachelor's. Um, Currently, I work in long-term care at ERCC, and I'll just give you a little background about our facility and what I do on a day-to-day basis. Um, we hold at least 100 beds. We've got a lockdown memory unit. We've also got 4 regular long-term care halls, and we've got a rehab unit. We do in-house PT, things like that for our rehab patients. The class that we're in now is the evidence-based practice, and we've been learning about different types of research methods and determining, after picking a proposed study to do in our facility, determining what type of study that is and why. So I'll go into the proposed study that I chose and what type of research method or research study that would be and why. So we had to decide on what kind of study we wanted to do based on where we work. And I chose to look at UTIs in my facility, which is a big issue anyways in long-term care. So I asked myself, we have certain residents that do have a lot of reoccurring UTIs. So I see this issue and I ask myself, what are we doing that could be better to help treat this differently, or what can the staff be doing to help prevent these from happening in residents that we already know have this issue? So, and the reason why this is important is because older adults have a harder time recovering from UTIs. The infection can be more fatal, and sometimes some older adults aren't able to say, hey, I don't feel good, or I don't feel right, or something's going on. So sometimes it just, it goes on too long, and then it gets to the point that it's very hard to treat. It can be life-altering for them. A lot of older adults with UTIs have extreme confusion, and with extreme confusion, we know comes falls and, things like that, and that's also life-altering. It's very costly for the facility and for the resident themselves, and because they have to go to the hospital or come back on antibiotics and things like that, that's costly to them. So I've asked myself, what can we do to prevent frequent reoccurrence in these patients? And I've identified 3 issues. The issue that I've identified is inadequate pericare. We normally, on a typical day, will have 1 nurse per 20 to 25 residents, depending on where you're at, plus 2 to 4 CNAs. Our CNAs, are certified, and they are required to take an 8-week course prior to working with these patients. However, I think that an issue that we could address with this particular problem is, since the CNAs are spending more direct care time with the patients, they need to know not just how to provide proper pericare, but why it's also important. Because I see a lot of them just kind of going through the motion of it, or just not doing it as well as what they could, and I think they need to be educated more on why this is such a big deal. And the other issue I've identified is unscheduled toileting times. A lot of our residents are on fluid medication, and we have a protocol that, you turn and reposition every 2 hours, you toilet every 2 hours. That doesn't always work for everybody. So I think that, we need to do some adjusting there and kind of make that a little bit more personalized. And then the third issue is hydration. Hydration goes a long way to preventing UTIs. They have plenty of opportunities during a normal day to have hydration at MedPass, at meal times, and then they have a snack cart that comes around every 2 hours. So that part of it is effective. However, there are some that aren't able to put the straw in the drink or hold their own cup. They're being delivered these drinks, but they're not being assisted any further than that. So I think that's another big issue that we need to work on. In my research, a lot of places kind of have the same issues, but UTIs are the second most frequent infection in long-term care. So this is a pretty prevalent issue. A lot of risk factors go into this with the older adult, which is lowered immune system, bowel and bladder incontinence, functional decline. A lot of them aren't able to help themselves do simple things such as get up and go to the bathroom or help themselves get a drink. And urinary retention and indwelling devices, which that goes more along towards, like, I see a lot of that in the rehab unit because we have a lot of patients that come from hospitals or they come from home. They come from various places. So the study that I've proposed to do, it involves the nurses and the CNAs. So it'll be observational, looking at the correct measures for prevention. What are we already doing that we're supposed to be doing, and what can be improved on? It would be conducted on the north side of the building, which I've chosen that side because that is the side with, I think it's got higher acuity, so we have more reoccurring UTIs in that part of the building. We would contact it would involve the nurses, the CNAs, and the high-risk residents. The nurses and CNAs would be contacted via work email, and then, of course, the residents would have to sign a consent to just be observed. So, or their power of attorneys, either one. So the email would include the duties and expectations, the purpose of the study, what we're going to be looking at, and things like that, just so everybody's on the same page. They would just go about their normal day-to-day, work and just be observed. And like I said, the study would be about the UTIs, and we would be watching this over a course of 8 weeks. I've already stated why it's important. Basically, this is just such a prevalent issue, and I think that, we need to be looking at what can we do better, because I think these are simple things that could be easily corrected that would have a very big impact on the quality of life for our residents. And then the study would just be observation. We would just be watching, how are they performing their pericare? Is there certain things that they can improve on? Is there, the high-risk residents, is there a trend of things that are being done? So the 3 types of research methods that we had to choose from were descriptive, qualitative, and quantitative. Descriptive research would be a mix of both qualitative and quantitative. It's not useful for determining cause and effect, and you have to have your research question and design your study, but it's a mix of both. Qualitative is watching real-life situations as they occur. So my study would be considered a qualitative study because we would be observing a real-life situation as it unfolded. And quantitative would be to test a theory, and at the end of it, you would have numbers to turn into numerical analysis to identify trends. So my study would also be a mix of the quantitative, because at the end, we would have some numerical data to identify a trend with the UTIs and the high-risk residents. Overall, the influence of this on the evidence-based theory is providing better patient care and reducing costs to the facility and the residents, and providing, the opportunity for higher quality of life for these residents, because, when you get sick, you don't perform as well as you could, and a lot of these residents, they're older anyways, and these reoccurring UTIs, it takes a toll on them, and, small things that we can do to help improve their quality of life and their function and help them be independent for as long as they can goes a long way. So that's my proposed study. Does anybody have any questions?
Yeah, I have a couple. So, you mentioned your patient ratios. I mean, 20 to 25 patients. That's that's a lot of patients to have to keep track of. And then, you've got your CNAs. So, and you said sometimes only two. So they're averaging 12 to 14 patients. So time is obviously a huge issue. So I'm wondering, um, does your facility do like in services, where you go back and you recertify on certain scenarios like every year? Maybe something along like putting in pericare, where everyone has to take an in service on, and they have to demonstrate the skills. They have to, not necessarily take a test, but just go and you express the importance why you're doing it. Is that something that your facility does?
They do, but not quite specific to certain skills. CNAs are required to take a refresher course. I think it is every year. And then we have monthly mandatory meetings where they touch on, like, if they have a higher rate of falls or something that month, or just like the biggest issue that month, and we have to take just like kind of like a brief little test or something like that on there. And then on our every monthly meeting that we have, our infection control nurse will come in and she'll pick a topic. So a lot of times it is things like pericare and stuff like that. And then monthly we have online virtual scenarios that we have to do, but it's not necessarily towards patient care all the time. It's just safety a lot of times, stuff like that. But I do think that would be good. That would be another thing. I think part going along with the education part. I think that we need to pull these CNAs out and say, hey, you need to take an in-service, something that's more hands-on and more, other than this is how you do it. They need to know, why is this important? Like, I'm not just doing this to do it. Like, why? What impact does this have?
And then, do you have like a measuring scoring type system? I know you mentioned like high risk patients. Do you guys have like a tool that you use if, say someone starts with a low grade temperature or starts with confusion? Do you guys use like a measuring system to track, who could meet criteria so that you can like notify your doctor? Um,
A lot of times, like our infection control nurse, she's in charge of the McGreer forms, which a lot of other facilities use this. I think it's a nationwide thing that they use. And basically, what it is, it's like um, we have to fill out criteria of if someone's placed on an antibiotic, or they are getting to the point where they probably do need to be evaluated. It's and it asks things like, it's for like respiratory infection, urinary tract infections, and things like that. You have to meet the criteria to do it. I think that it goes along with reducing the overuse of antibiotics. But mainly, like, if we notice, hey, so and so's kind of getting to that point that he or she may have a UTI. A lot of times we contact the doctor and they're just monitored for a while, but um, we do have a protocol in place, but it also could use some improvement.
And then one last question. So, I know most nursing home facilities don't have an inpatient lab or like a lab service. So, how long does it take? So, let's say you do a urinalysis and you send it off because clearly you have to send it out. Is that right?
Yeah.
Yeah. So, or doing blood work to determine if the patient is potentially septic from the UTI. I know, so there's lots of things. So my question is, what's the turnaround time on that? And, to get labs. And then, do you think that that also hurts, like, the patient and getting treatment and, things like that?
Normally, like if we start to notice something and the doctor says we'll go ahead and get a urinalysis. Sometimes the issue with that is it's not the wait time from the lab, it's getting the urinalysis because a lot of these residents that have incontinence, you can't get a clean catch on them. So you have to straight cath. And sometimes that's really difficult. Sometimes, you'll have the nurse that gets the order that, isn't able to do it, or maybe isn't that skilled with caths and things like that. Or, you know, maybe you have a resident that's like trying to beat the living daylights out of you, and so that's the issue with that. Normally, whenever it is obtained, um, we do have people that will run it straight out to the lab, and then it usually takes about 24 hours to get all the results back and stuff before the doctor will say, yeah, they do need an antibiotic, and this is what we're going to do. So there is a little bit of a wait time. It just, more or less, it just depends on how are you getting the specimen and how long is it going to take for you to get it and then getting it out. So the wait time there, yeah, it can be hurtful. All right, well, thank you everyone for your time, and I hope you enjoyed my presentation.